Hi, this is Lauren Proctor, Skills Checkoff 37.5, South Florida State College LPN RN Transitions Program. So this would be the nurse on the floor receiving the patient from the PACU. So I would get get a report from the nurse before she brought the patient up. Be in the room waiting when the patient was supposed to be there. Identify the patient using 2 patient identifiers, hand hygiene. And just continue assessing the patient, monitoring the patient's airway for safety, make sure the patient's still doing okay, making sure that their pain's under control and managed. Go ahead and assess, full head-to-toe assessment, vital signs, make sure their telemetry monitor's still running, IV fluids if they still need them, assess the patient's surgical sites, drains, anything like that. Make sure that they still have their SCDs or their compression stockings on for how they should be. Check their circulation. Listen for their bowel sounds, lung sounds. Make sure that the patient goes to the bathroom, within a day or 2 of the anesthesia, and make sure that the patient voids, within 8 hours or so of having their fully catheter DC'd if it was DC'd in the PACU. Measure all my I&Os from all my different sources if they do have drains or not in. And then, just start, when the patient starts to become more alert and everything, and the anesthesia is worn off and they're not in pain, obviously, start checking to see if their readiness and willingness to learn. Make sure that they're using their incentive spirometer. Make sure that, we're teaching them little things as they're recovering at the hospital. Make sure that their family knows about it, and how, what's going to go on. Make sure that the patient has a full understanding of what's going to be going on while they start to recover. All the while, once again, make sure we're assessing for safety and pain and their airway. Make sure that the patient, when it is time for them to go home, if they get to go home, or when they get to go home, I should say, make sure that they have their teaching materials with them, make sure that they understand what needs to be happening and everything. Make sure that that they have their prescriptions and everything needed when they go home. They have their follow-up appointments, answer any questions that they may have. And that's it. Thank you.